Since its outbreak in December 2019 until today, when we begin to visualize that the infection by COVID-19 virus is becoming an endemic disease that will remain with us, tens of millions of people's health worldwide have been affected and many died. From the initial absolute lack of knowledge of the biology and pathophysiology of the virus, a fast progress has been made in characterization, diagnosis, treatment, and above all, prevention thanks to vaccination. This, together with the evolution of the virus to increasingly less aggressive variants, led to a significant reduction in the severity of the most severe symptoms. One of the most perplexing characteristics of the virus is its ability to integrate and affect diverse organs and tissues, therefore presenting a varied symptomatology as well as its persistence over time in a significant number of cases, leaving permanent or medium, even long-term sequelae. The reproductive tissues and functions are no exception. Several questions in this regard have been at least partially resolved in these 2 years, describing the real effect on males with respect to their fertility. Is the male susceptible to the virus entering its genital tract? The testis is a potential target of this virus, since transmembrane serine protease 2 and the receptor angiotensin converting enzyme 2 are used to infect. Is the male susceptible to the virus entering its genital tract? The testis is a potential target of COVID-19, since transmembrane serine protease 2 and the receptor angiotensin converting enzyme 2 used to infect host cells have been described on Leydig and Sertoli cells. This means the virus has a way to get into the male reproductive tract. Nevertheless, clinical reports are more negative than positive when evaluating the presence of the virus within the testes of deceased men. And on positive cases, it was unclear whether the virus came from blood or testicular cells. Thus, the possibility of SARS-CoV-2 present and disrupting testis function cannot be ruled out, but on COVID-19 patients with mild symptoms seems unlikely or negligible. If it does enter, how does it impair semen quality and fertility? Male fertility impairment in patients with COVID-19, mainly on the acute phase, may be caused by overproduction of inflammatory cytokines, autoimmune responses, infiltration of leukocytes, disrupted spermatogenesis, severe inflammation damages, also interference with sex-related hormone secretion, impairment in the blood-testis barrier. Declining sperm quality, orchitis, and scrotal discomfort were observed in COVID-19 patients. Although it is very questionable for mild cases, compiling clinical data is still lacking. Is there a real risk of sexual transmission? Current evidences does not support sexual transmission of the SARS-CoV-2 virus on data from 6 small cohort studies where viral nucleic acids in semen samples from mildly affected and recovered stage male patients were not detected. Although one study showed that 8.7% clinically recovered and 27% acute phase patients tested positive for viral components in their semen, probably being false positives caused by sampling and detection errors that cannot be ruled out. Are these effects permanent or transitory? Potential long-term effects have not been assessed so far, not even on persistent COVID cases. A significant clinical harm on long-term reproductive performance of COVID-19 infected males should have been already detected if this was the case. Regarding the preventive measures, does the vaccine affect semen quality and therefore fertility? There are 2 very recent studies assessing the potential impact of vaccine on semen quality, both showing safety of vaccination protocols on male fertility, comparing the semen parameters and fertilization rates before and after vaccination. Semen parameters did not change after the exposure and fertilization rates were comparable. This was true for the different types of vaccines too. In conclusion, for our peace of mind, we can conclude that facing a new era with high percentage of vaccinated patients generally showing mild symptoms and with weakened variants, the overall effects of COVID-19 on male fertility should be considered marginal, although deserving a close follow-up.